Digestive disorders disrupt our lives in ways many of us may be too embarrassed to talk about. Crohn's disease, colitis, IBS, and diverticulitis are just a few of the disorders that can cause symptoms like abdominal pain, bloating, constipation, diarrhea, fatigue, and sometimes even rectal bleeding. It can sometimes be hard to tell which symptoms are just annoying nuisances and which ones are red flags that may indicate a more serious underlying condition. Today, we're going to help you make sense of your symptoms, as well as answer your questions here on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions, and I love answering them. My name is Dr. Kamaljeet Kaur, and I'm a primary care physician. Let's get right to our questions. Today's first one comes to us from Stanley, and Stanley has reached out through our website, allhealthtv.com, asking, Hey Doc, my buddy Vic called me and the wife a few days ago and said he was diagnosed with something I think he referred to as IBS, but my wife thinks he said IBD. Are they the same thing? And if not, what are the differences? Hi Stanley, great question. Before I address it, let's take a look at this video from our friends at the Mayo Clinic.
People often associate inflammatory bowel disease with the bathroom because of its symptoms, but it's a serious and chronic condition. There are two main types of IBD, Crohn's disease and ulcerative colitis.
Ulcerative colitis only impacts the colon and causes inflammation in the entire colon, while Crohn's disease can impact anywhere from the mouth to the anus.
Patients often experience diarrhea, rectal bleeding, fatigue, weight loss, and stomach and joint pain.
Some patients might develop what we call extraintestinal manifestations of their inflammatory bowel disease, and these can impact other organs. That means organs that are beyond the intestines.
There is no cure for IBD, but there are medications to reduce inflammation. Also, watching what you eat can help alleviate symptoms.
We have to have a focus on diets that are high in anti-inflammatory foods and antioxidants, and low in foods that are processed that can be pro-inflammatory.
For the Mayo Clinic News Network, I'm Sonia Goins.
So as the video explained and Dr. Chetty talked about, there are a lot of things to consider when it comes to IBD, which is inflammatory bowel disease. And let's talk a little bit about how that compares to IBS, which is irritable bowel disease or syndrome. Now, the names themselves, as you can see, can get confusing, but they're quite different entities on their own. And let's point out actually what they are. A little bit about IBS first. Irritable bowel syndrome is actually a functional disorder that's typically not associated with biochemical or structural abnormalities in the intestine or the colon. Now, inflammatory bowel disease, by its namesake, you can tell, it's an organic immune-mediated disorder that causes chronic inflammation, and sometimes that leads to mucosal damage and even bleeding in the colon. It can be a lot more drastic as far as clinical characteristics and symptoms go than IBS. IBD is an umbrella term, so this means it is a term used to describe a group of diseases. And in this case, those group of diseases are individually known as ulcerative colitis and Crohn's disease. While they are both inflammatory conditions of the intestine, they have their own characteristics. So you have IBS, which is irritable bowel syndrome. You have IBD, which is inflammatory bowel disease. Then under IBD, you have Crohn's disease and ulcerative colitis. I know it gets confusing, but they're all very different, well, somewhat different, and they have their own characteristics. That being said, sometimes these can also present quite similarly. So they have the potential to cause abdominal pain, all of them: irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, Crohn's can all cause abdominal cramping or discomfort. Bloating may also be there, and sometimes even changes in the way you go to the bathroom, diarrhea, constipation. The one thing in symptoms that is not common to all of them, though, is rectal bleeding. Typically, we do not see rectal bleeding in irritable bowel syndrome. This is why it's so important to seek evaluation with your doctor if you experience symptoms, because there's really no way to know just by the symptoms alone if you're having IBD, IBS, UC, or Crohn's. And it's important also because the treatment will differ as well. Now, IBS, irritable bowel syndrome, the treatment is focused on symptom management. Because there's not really actual biochemical or structural abnormalities in the mucosa or in the intestine or in the colon or the GI tract, there's really nothing, no medication to treat, to target anything except the symptoms that you're feeling. So if you're somebody who has diarrhea predominant IBS, then you're probably going to want to take antidiarrheals. If you're somebody who has constipation dominant IBS, then your doctor may give you laxatives to be a little bit relieving. And sometimes there's some individuals that have what's called mixed IBS. So you have a little diarrhea and you have a little constipation. And really navigating and playing that game can also be a little complex, but this is why you want to talk to your doctor and get his or her guidance for what is best for you. The other component of treatment when it comes to IBS, irritable bowel syndrome, and something that's very important but sometimes overlooked is the mental health aspect of it. IBS can oftentimes be diagnosed along with or can be seen in patients who also have some mental health conditions like anxiety or depression. And it's very important to manage those aspects as well because we all know physical health and mental health are very much connected and can very much negatively or positively impact one or the other. So the treatment regimen for IBS is really holistic, sometimes medications, sometimes therapy, and oftentimes both. What about IBD, inflammatory bowel disease? This is something where the treatment is focused on the use of medications to reduce that inflammation that's overactive in the colon. And these medications can be corticosteroids, they can be biologics, and other therapies that really target that part of the immune system that's overreacting and causing all that damage. And this is something that may take time. You may need to be on these medications for a while before they kick in. Sometimes, like with steroids, they may work a little bit faster, but the point is to calm down that inflammation and to prevent the disease from getting worse and from causing complications, sometimes even in other parts of the body. Speaking of complications, it is important to note that though it can cause symptoms that are life altering, annoying and really just intrusive symptoms, IBS, irritable bowel syndrome, is not something that poses a significant threat to your overall health or your overall life. It's not something that's going to give you life-threatening complications. Irritable bowel disease, on the other hand, and unfortunately can produce serious complications both within the intestine and even outside of the GI tract. A few of these are fistulas and strictures. These can form within the intestine or the colon and can cause issues on their own. Also, individuals can experience arthritis, skin disorders, anemia, osteoporosis. Some studies have also shown an increased risk of heart disease in individuals who have inflammatory bowel disease. And the one complication that we never want to ignore or forget about is the increased risk of colon cancer in individuals with inflammatory bowel disease. That's why it's so important. If you have those symptoms that are kind of vague and they're just not going away, get it checked out as soon as possible. You want to get the proper investigation and testing done to figure out what it is. And then once you have the answer of what it is, then you can formulate a plan. Whether that plan includes something as simple as changing your diet, well, I say simple, but we all know that's not very simple, or exercising more, or medications, or colonoscopies every year or 3 years. Whatever it is, once you know what it is and you have a plan, then you can be on the way to preventing the complications and living a healthy life essentially. So as you can see, these two conditions, it's very, very important to know and to differentiate between them. All right, let's get to our next question. This one comes to us from Dhani, and Dhani asks, Namaste, Dr. Kaur. My husband went to the doctor yesterday because he's been having stomach pains lately. He then came home belly aching, pun intended, about his doctor telling him he needs to add probiotics to his diet. What are they and how do they help? Hi, Donnie. Thank you for your question. It was really punny indeed, and thank you for reaching out to us. While probiotics are very important for our gut, they have benefits that span almost all parts of our body. Probiotics, what are they? They're tiny little microorganisms that actually do good in the body. I know you might think microorganisms in my body, but you know what? They're very important and they do a lot of different things that help us stay healthy. And most of metabolism with weight management, there's so many good things that probiotics and healthy bacteria in our body and in our gut specifically can do. So we want to make sure that we're keeping our gut as healthy as possible. Now, while most people think that probiotics are only found as tablets or capsules, actually the best way to get probiotics is through actual natural foods. Let's go through a little list of these foods because I think it's important. And hey, maybe you're already eating some of these foods, or maybe you see them in the grocery store and you might think, hey, what is that? But now you might be motivated to eat them more often or to, actually purchase and try them. Some really good probiotic foods are kefir, Greek yogurt, sauerkraut. I personally love sauerkraut. I can eat it with just a fork. Pickles are good. Miso, kombucha. Personally, I'm not a fan of kombucha, but I do respect the benefits of it. Tempeh and kimchi. These foods are often kind of exotic, but you know what? They have such good benefits for our body. So I do encourage you to try a few of them, as long as you're not allergic or you don't have an upset stomach with them. Eat everything in moderation. Let's not, eat too much kimchi in one day. That can actually be quite irritating to the stomach, but try them and who knows, you might even like them. Of course, these are wonderful food sources of probiotics. And like I said, I really would encourage you to try some of them as tolerated. But always talk to your physician before you make any drastic changes because there are certain times when, even though a certain food is good for you or noted to be good, it may actually have other properties that may not be very beneficial for your particular circumstance. So always talk to your doctor before making any drastic changes. And if you're taking probiotics as a supplement or a tablet capsule, then especially important to run it by your doctor and make sure that the ones you're taking are good because there's so many that are out there. You want to make sure that you're taking a good one and one that doesn't have a lot of extra fillers and other things that you need. All right, let's move on to our next question. And this one comes to us from Maria. Maria submitted this one is a non-digestive question. Let's get to it. Hi, Dr. Court. My doctor just told me I needed to be on blood pressure medication. I take a lot of vitamins and health supplements. Are there any that I should avoid because they can interact with the blood pressure medications? This is a great segue or piggyback from our last question. When it comes to supplements and vitamins, most of us think that they're all good and they're all wonderful and we should take them all the time. But as you can see here, that's not always the case. I'd like to point out and really highlight the thing that I said just a little while ago. When you're on any medications, prescription medications, or you have certain health conditions, you should avoid taking over-the-counter medications and supplements without consulting with your doctor first. And I know sometimes we think, oh, but this medication's available over the counter, so it must be safe. And typically that's true. But like we're going to point out in just a second, certain vitamins and supplements can actually be dangerous when combined with other prescription medications. For example, a lot of multivitamins have potassium in them, and actually a lot of vitamins have potassium in them. But if you're somebody who's on certain blood pressure medications like ACE inhibitors, or better or more commonly known as lisinopril, or the sister medications losartan, those medications inadvertently or have notably your heart. It can affect your heart, and that's really not something that we would want. You could turn yourself into a life-threatening situation, and that would obviously be very, very not good. And what about other blood pressure medications? Because there's the lisinoprils, the losartans, but then there's also diuretics. I know a lot of individuals who aren't diuretics, and certain diuretics can also increase potassium naturally. So you want to make sure, again, you're not taking it with those medications either. What about vitamin D? I know we're talking about vitamin D a lot nowadays, and majority of us, for some reason, aren't really fully sufficient in vitamin D. So many people do take vitamin D supplements. But it's important to note that there's certain thiazide type diuretics that can, when you take them with vitamin D, that can actually be pretty harmful because it can elevate the amount of calcium in your body. And just like potassium, Calcium has its hand in a lot of mechanisms in our body, and it does a lot to keep us healthy. But when it is in excess, then that can be a dangerous situation. Again, just like potassium, most notably in the heart, it can affect your heart rhythm and throw you into an arrhythmia, and that's something that we don't want either. What about herbal supplements like ephedra, St. John's wort, yohimbine, licorice root? I know some of these may sound very foreign to you, and some of them are pretty common, but they're particularly concerning because they can increase blood pressure on their own. And then if you combine them with a medication that's trying to lower your blood pressure, that can actually imbalance the BP a lot. And that's obviously not going to be a good situation. We're going into, supplements and vitamins, but what about medications? So, Sudafed, decongestant, pseudoephedrine, these are taken many times when somebody is congested, they have a sinus infection or, a cold, and usually it's okay to take them for a day or so in most cases, but these medications can seriously increase blood pressure. And in somebody who has a heart condition or who has elevated blood pressure at baseline, or who's had a heart attack in the past, these medications are oftentimes contraindicated. In fact, I tell my patients who are on high blood pressure medication or who have heart disease to avoid them altogether, because the way they work in the body can actually put more pressure on the cardiovascular system. And obviously, that's not going to be a good situation either. All right, folks, in case you missed it the first time, here's how you can keep sending in those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, let's keep going. And the next question comes to us from Jonah, and Jonah writes to us from Instagram asking, "Hello, Dr. Kaur. I just turned 40 and my PCP ordered a colonoscopy for me. I've never had one before. Is this common? And what exactly are they looking for?" Hi, Jonah. It's never a bad idea to get a certain test done if it's medically necessary, but I'm really wondering if you have a family history of colon cancer or if you're having symptoms yourself that may have necessitated the test. Because at age 40, we typically don't recommend a colonoscopy unless there's a really highlighted reason for it. And I'll tell you why. Current recommendations from most of our major medical societies are saying to begin colorectal cancer screening at the age of 45. You may or may not remember, but about 3 to 5 years ago, this recommendation was quite different. It was starting age 50 is when we would start to talk about colon cancer screening. Because we're seeing more and more colon cancer in the United States and in younger populations, and this has been seen over years of studies that we've done, we have reduced the age range to 45 to catch things earlier and to prevent them from getting worse and becoming life threatening. So that's why that age is now from 50 to 45. But still, you're 40. So then that begs the question, is there something else going on? Now, if you have a family history, say for instance, a first degree relative, so a mother, father, or a sibling that was diagnosed with colon cancer at age, let's say, 50, that would warrant you to start getting colonoscopies for colon cancer screening 10 years before them. So if they were diagnosed at 50, then starting at 40, just like you are, would be absolutely recommended, and that would be the standard of care. But if you don't fall into that category, then I'm wondering if you're having symptoms. If you're having symptoms like we talked about a little earlier, rectal bleeding, abdominal pain that just won't go away, or difficulty eating, or always having flipping diarrhea and constipation, any of those abdominal symptoms, and they've been persistent, and maybe your doctor has done some blood work and just can't find the answer, the next appropriate step would be colonoscopy, because it is still the only way for us to take a look inside of your colon, see what's going on. And then the most important thing is that while the doctor is in there with the colonoscope, they can see if anything needs to be biopsied or removed, and typically they can take care of that right there and then. Now, when we talk about colon cancer screening, it's also important to note that for average risk individuals, so somebody who doesn't have a family history or a personal history or any increased risk factors or symptoms or anything else going on, typically there are other ways to screen for colon cancer. Now, these are non-invasive tests like the home stool test that can be done. These aren't preferred. The colonoscopy is still preferred because, like I mentioned, it's the only one where we can look and see what's going on inside and perhaps take care of things that need to be taken care of right there and then. Whereas the other tests, even though they're very convenient, you do them at home and in the comfort and privacy of your home, and you get results in a couple weeks. They can miss things because they're not all inclusive when it comes to what they're testing for. So just keep that in mind. I hope your colonoscopy goes smoothly and comes clean, and you have nothing to worry about. And I hope you stay healthy. All right, friends, let's move on. Our next question comes from Oren, and Oren is asking, Hi, Dr. Kaur. This is a little embarrassing, but I've been having a slight diarrhea issue as of late. It really doesn't matter what I eat because I've had some really fibrous food lately and I'm still dreading going to the bathroom. I guess my question is this: when should someone with chronic diarrhea seek medical help? Hi, Oren. Thank you for sending us that question. And actually, you answered it, because asking for help or asking when should I go to a doctor right here on this show is kind of doing it. So I'm glad you did. Now, chronic diarrhea is a good indicator that you may have something going on with the digestive system. As with many other symptoms, especially in the GI tract, like I mentioned, seeking medical attention is recommended if they last for more than just a few days, or if the symptoms are excessive, if you're having unrelenting abdominal pain, if you're going nonstop to the bathroom, or on the other hand, if you haven't gone to the bathroom in, say, 3 to 5 days, or if you're having bleeding with bowel movements. Sometimes fevers can be a presenting sign with abdominal pain, and that could also indicate that something else is going on there. These could be signs of something more serious, or something that may just require some over-the-counter medications. But either way, it's important to seek medical attention so we can have that detailed discussion with our patients and see what the next steps in evaluation should be. Most importantly, if we can catch any disease early and prevent it from getting worse, that's always going to be the best treatment. I encourage you to reach out to your primary care physician and begin this evaluation. You may need some lab tests, and that may help you find some answers, but you may need to go further and even get a colonoscopy. Either way, I hope it's nothing too serious and you're back to being your healthy self again. All right, we have a really interesting question here from Facebook, and this comes to us from Katerina. Katerina is asking, Hi, Dr. Kaur. I've been experiencing severe pain, constipation, and diarrhea for the last 4 months. My doctor referred me to a gastroenterologist who now suspects that I may have Crohn's disease and wants to run a battery of tests. Can you please tell me what Crohn's is? Hi, Katerina. I'm sorry you're going through this. And to be honest with you, I'm kind of in a similar boat. My doctor's also trying to figure out if I have Crohn's disease. So this one hits home, and I am going to try to give you the best information that I can to make you feel better. Now, as we spoke about earlier, Crohn's disease is an inflammatory condition of the intestine. It can cause a variety of issues, including some of the symptoms that you've been experiencing. We often talk about what a disease is, but I'm also sure that you want to know why. And I assume this because when my doctor talked to me about it, one of the first questions I had was, well, why? How did I get this? Or if this is what I have, how did this develop? If I have the beginnings of it or a late stage, you always want to know why, because then that helps us formulate the plan for the next steps. Now, Crohn's disease, like many other conditions in our body, develops due to a whole host of factors. This could be genetic predisposition, lifestyle factors, so smoking, drinking alcohol regularly, eating a lot of highly processed foods could contribute to the inflammation. There's also sometimes alterations in the gut microbiome. So you may not have as much healthy gut bacteria or microorganisms that you may need. And there's always a little bit of immune system dysregulation in an individual who develops Crohn's disease. The exact mechanisms are not known, but this perfect storm has to come together in order for this to occur. And while this can be quite complex, the main thing to know is that it's an inflammatory condition. There are treatments for it. And as soon as you know what is actually going on, I'm sure your physician will give you a good plan to move forward and to help keep you healthy. Here's hoping that your tests come back nice and clean, and this isn't even something that you have to worry about. All right, folks, that's all the time that we have for today. These were some wonderful questions. I hope you got some really good information to help you stay strong and healthy and prevent disease. As always, my name is Dr. Komaljeet Kaur, and I'll see you here next time on Ask the Doc. No appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD.